Okay, let's talk about the focal seizures. So it can be also classified as a primary epilepsy and secondary causes. Uh, Secondary causes might be due to stroke, like CVA, tumor, brain tumor, trauma, and infection like TB, tuberculosis granuloma, neurocysticercosis, inflammatory condition like vasculitis, SLE. These can cause focal seizure. Focal seizure requires systemic evaluation because identifying and treating the cause may cure the epilepsy. And these secondary causes are very much common in developing countries like us. So the difference between primary and secondary cause for focal seizure are primary epilepsy is idiopathic and is often genetic. So secondary epilepsy results from identifiable pathology and must always be excluded first, as it can be treatable and curable. So what to ask in focal seizures? Yeah, we need to ask about the history of the head injury, bot aphasia or bot trauma in case of child or infants that coming to in a seizing state in emergency. A central nervous system infection in infancy can cause scarring and that may lead to the seizure, focal seizure. Fever might indicates meningitis, encephalitis, weight loss, anorexia might be happening in malignancy, tuberculosis granuloma, and also if there is a presence of headache that is worse in morning along with vomiting, which indicates raised ICP and space occupying lesions. So these can cause focal seizures. Also asks about the previous history of seizure, any investigations, or whether the patient has stopped medications that might lead to the seizure at present. We need to ask about the past medical history also, especially previous stroke, neurosurgery in the past, or SLE, vasculitis, sarcoidosis conditions, and a patient having hypertension or heart disease may lead to stroke, and that can cause secondary epilepsy. Also, known malignancies such as of the lung, breast, bronchus that may have metastasis to brain. History of epilepsies in families rise like likelihood of epilepsies as there is a genetic predisposition to the development of epilepsy. Family history of mental retardation, early neonatal or childhood deaths also suggest an inherited metabolic disorders. So a proper history will help in identifying the cause of the seizure. Okay. So if patient present in seizing states, so we need an immediate management. In an actively seizing patient, ensure safety of the patient as well as self of the doctors also, and perform a primary survey, give oxygen, check glucose, and protect from injury. But do not restrain the patient or insert any objects into the mouth because of the risk of aspiration. Post seizure examination, when patient presents sometime after seizures, we need to look for focal neurological deficit, whether it is present or not. Example, a patient is not able to move one side of the limb or any focal deficit. Also, any sign of raised IC intracranial pressure like bradycardia, hypertension, lateral gaze, palsy, and fundoscopy papilloedema. We need to look for anterior frontal feel for the anterior frontal and head circumference in neonates. In case of the meningitis or other infectious condition, intracranial pressure rise condition, they are abnormal. Look, ask for hypertension because that may lead to stroke and encephalopathy. Any dysmorphic features, hepatosplenomegaly, failure to thrive history that indicates inborn error of the metabolism. Also, neurocutaneous markers like SLIF, macule in tuberculous sclerosis, which is a genetic disorder. These may indicate all of these indicate secondary causes, and if we identify it right on time, it can be curable.